Hi, I'm Geoff. I'm the CEO and Managing Director of Medtech Global. We provide patient practice management solutions to primary care across Australia and New Zealand. We mainly work with general practitioners in both countries, helping them run their practices to do the best job that they can do. Today's presentation is going to be about taking shortcuts can get you lost. For the past 20 years, I've worked across Australia and New Zealand, largely around interoperability and how do you get information exchange working. But what we've learnt over the last 20 years is that often we have taken shortcuts or done things quickly without really thinking about the long-term consequences. And that's really limited us and our ability as organisations to be able to work within primary care. People often ask what your why is and why you do what you do. For me, general practice has been an important part of my professional life, and my passion for general practice centres around the fact that a lot of the population at some point in their life will engage with the general practitioner. General practitioners serve their local communities, helping people through difficult times in their life, helping them navigate how the healthcare system works, which can be quite complex and daunting. Given the fact that so many of us need to work with GPs, with our family, our children, to me it's a great opportunity for us to improve health at a population level, as well as helping GPs do the great job that they do in dealing with the people that present to them each day. I started my working life as an academic in general practice research, largely investigating why people turned up to general practitioners, what were some of the challenges for GPs in managing patients, what were some of the issues around vaccinating children. Many of those problems are still with us today. Even though that work was published 20 odd years ago, I felt I really hadn't made a difference. So working in the health IT sector, I felt I had a better opportunity to change the way that general practice was working, particularly around the way that they interoperate or communicate or share information with other parts of the healthcare system. As a society, we actually make it quite hard for GPs to be GPs. There's a lot of paperwork, there's a lot of complexity. People can turn up largely with whatever they want, whenever they want, and so it's quite difficult for a GP to do the most efficient job if we don't make the whole exchange of information significantly easier. So, from Medtech's perspective, our focus is on healthier care. We focus on that because we always want to be able to do things better. For us, it's more about ever improving the way that general practice and primary care works, so that it's easier for practices and easier for consumers and patients to work with GPs. Part of our motto is professionally satisfying, financially successful. If we can help practices and users of our software feel professionally satisfied, they're more likely to stay in general practice, they're more likely to keep contributing to their communities. In terms of financially successful, improving their financial success means they can afford to keep being a primary care delivery service for their community. Interoperability and partnering is a key part of primary care because most people have to share information at some point with other parts of the healthcare system. The best way to make this work is through standards, trust and interoperability, so that the same information can be delivered through different mediums so that you get the same answer. Lastly, we believe that by making small steps together, we make a much more significant impact than one large step by one organisation. Given primary care deals with 70 organisations on an average week, it's really important that working collectively together, we can make those huge inroads into improving health. One of the initiatives we brought to Medtech was the application layer exchange platform known as ALEX. This was really about standardising the way that information sharing works. If we look at how interoperability works today in general practice in New Zealand in primary care, you could possibly argue it's largely the Wild West, with many different ways that information is exchanged. A lot of those ways are not supported, a lot of those ways you would be considered proprietary. And for many of those systems, they're not scalable, they're not reliable, and they potentially create increased risk to the users of those services. For us, it was really important for us to establish some ways so that we can take this forward. Looking at specifically how interoperability works today, it's bespoke. And what we mean by that is solutions have been built with one use case in mind. It might be built just for pathology, it might be built just for referrals. We're not using consistent ways so that the information sharing is the same no matter which way you do it. You'll start to get too many variations and it's quite hard to support. Also, for many of these solutions, they rely on another piece of software on the doctor's desktop. to add to the already large number of pieces of software in their environments. Those types of solutions are quite hard to scale, they're quite hard to maintain, and they're quite hard to support. All of these applications inadvertently will affect the performance of the GP software. At the end of the day, they're using the software to treat the people in front of them, but if a whole bunch of applications are degrading the performance, that experience when the patient's sitting in front of you can be somewhat compromised. The data integrity, if you're using a solution that isn't actually properly integrated or someone has built thinking they understood how the software works, you run the risk of getting the data wrong or your understanding of what the data is about. So when you share that information, you may have taken it out of context, creating unnecessary risk or confusion. Transaction delays. Many of our solutions that are in place, or many of the solutions in place, rely on dated methodology, so it's not real time. So you're waiting as opposed to a real-time exchange of information. If you're looking up something real time, you need an answer now. You don't want to find out in an hour's time that slot isn't available. Privacy and consent. Sadly, many of the solutions that have been put together haven't really gotten a clear understanding from both the user and the patients of what it is they're consenting to. That misunderstanding ultimately can undermine the trust in the system. So for us, it's really important that the doctor-patient relationship is being respected, and that those individuals are the ones who are deciding what is happening to information sharing. And lastly, the cost of innovation. In developing bespoke solutions, you run the risk of increasing significantly the cost of innovation. The problem with bespoke solutions is each person is doing something slightly different, and they spend more time on accessing the data than they do on how to use the data or the consumer or the doctor's experience. If you spend a lot of time accessing the data, you're not spending time on working out how to get the best outcome for the patient or the doctor. So, the case for change was very apparent to us. It affected all groups: consumers, GPs, funders, PMS vendors. For us, it became very apparent that it was really important that we use this opportunity to deliver a much better way of information exchange. The cost, security, privacy, innovation, experience for what people are having was not being realised where we have seen that in other sectors. If we look at the banking sector, the retail sector, we're getting quite different experiences, yet health, we're not getting those experiences, largely driven by legacy bespoke solutions. Design principle. In building ALEX, we decided that we would use a number of principles to give us the best chance of the best result and deliver on the promises that we gave ourselves and that we gave to the market. First of all, buy not build. If there's technology and capability in the market, why not use it? Why do we think we can build everything for everyone? Why not partner with the people who are the best at what they do? Event driven. Very important concept is, in respecting the doctor-patient relationship, you have to only take information when you actually need it, or request information when you actually need it, or share information when you actually need to. By making it event driven, the doctor and the patient is at the forefront of the decision making. It's not being made by the software, it's not being made by a third party, it's being made by the people who need to make those decisions. Security by designing it from the very outset to ensure that the privacy, security and confidentiality was being maintained. From the very start, we were focused on the security aspects of what the platform was going to deliver. Loose coupling essentially largely means that rather than being dependent on Medtech all the time, how do you build an application layer exchange interface so that people can make their changes, their developments without relying on Medtech? Standards based. The big advantage of standards is you can scale, you get predictability, and that way you get more people being involved rather than customizing proprietary solutions. So people can start working on their solutions by the standards that exist today. And win-win partnerships. Again, by working with people who are like-minded, you're able to deliver a lot more. Those small steps by many allows you to give a lot more offerings and benefits to the users of your software. The ALEX solution is quite simple in many ways, although the diagram may suggest otherwise. It's largely taking on-premise solution or in the cloud solutions for patient management, practice management systems, and exposing in a secure way an API that allows for third-party applications to make requests of information if and when they need it. This allows the security to be maintained, it allows the sharing of information to be maintained, and allows the predictability of the information that's being shared so that the software knows exactly why it wants what it wants, as well as being able to present that data in a meaningful way and a consistent way, so that if you ask for the same data, you get the same answer no matter what software you're using. Our commitments to standards is demonstrated by the fact that most of our work is part of the New Zealand HL7 community website that shows our implementation guides. That way we're very open with how our software works, we're very open with the way that people can work into it. So as part of this initiative has been about supporting the standards community and using what's largely already available so that others can benefit from it and they also can speed up their innovation. Part of what we were wanting to achieve was to work with like-minded organisations who wanted to improve healthcare delivery. When we first set out on this journey, we thought we might get 5 to 10 partners. We clearly have exceeded this. We have many partners involved at various stages and many partners working with us to shape how interoperability can work in New Zealand. Many of these partners cover all sorts of areas of expertise and all sorts of areas of interest, from pathology diagnostics to referrals, to consumer applications, to improving the way that practices are managed, population health. There's lots of those partners. Already there are partners in production: ConnectMed, Heartbeat, Houston, Well Revolution, WebTools, JX and Florence are all got applications that are available for users. The future with ALEX is actually quite simple. It's putting into the cloud an application layer exchange that will support secure, consented, event-driven sharing of information between software applications. It's allowing doctors, patients, organisations to help manage patient care and the patient journey, while also helping practices manage the business of being a GP. These features cover event-driven, secure by design, loose coupling and digital speed, supporting innovation, supporting the fast tracking of new ideas to bring it to bear to make a positive impact on general practice. It's far more scalable using standards in this methodology. You're no longer limited by your ability of how many different bits of software you can get out there. It's more about how do you enable people to be able to use these applications. It's real-time access. You're not waiting for information. If you need information and you have the right permissions, you can get that information now. And what we are seeing already is better functionality. So people are spending more energy and time in developing new capabilities rather than trying to work out how to get access to information. The benefit of taking these small steps, it's helping practices be practices. It's helping clinicians be clinicians. It's helping consumers when they need it most. It's also helping innovators to innovate. When we first started this journey for myself 20 odd years ago, sometimes the most simplest things do a lot more than the more complex things. So even if it's putting a billboard on a motorway in Auckland to encourage people to go and see their GP, or whether it's an easier way to share information in a trusted and reliable way, that's what we're trying to do as part of our healthier care journey.